Hi, everyone. Thank you for joining the School-Based Health Alliance for today's webinar, The Hallways to Health Toolkit and Local Wellness Policies, the role of school-based health centers in creating healthier school environments. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend the majority of their time, in school. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, and behavioral health issues get quick expert attention. And we all know that healthy students make better learners. Now, we have a few housekeeping reminders. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the Q&A tool located in your Zoom control bar. We will address questions following the presentation. If you would like to add your comments through the chat function, please select all panelists and attendees before sending the message so everyone can see it. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 1 to 3 business days. Please also visit the School-Based Health Alliance website for additional archived webinars for topics such as the ones you are viewing on your screen. Now, I would like to introduce our presenters for today. Siobhan Simmons-Wright serves as a National Content Advisor focused on school policy and environment with the Alliance for a Healthier Generation. In this role, she provides technical assistance, professional development training, and develops best practice resources to improve local school wellness policy, school nutrition, and out-of-school time environments for schools and program sites across the nation. Siobhan focuses on building the capacity of districts, schools, and communities to make sustainable policy, systems, and environmental changes. She has brokered national collaborative partnerships to provide support and resources for local education agencies, schools, and communities. She has over 20 years of experience working in school and community settings, providing training, curriculum development, technical assistance, and brokering resources. Emily Baldy, our Program and Consulting Associate here at the School-Based Health Alliance, will also be joining us on this webinar to give an overview of our Hallways to Health initiative and resources. Now I will hand it over to Emily.
Thank you, Maddie. Hi, everyone. As Maddie said, I am Emily Baldy. I'm the Programs and Consulting Associate at the School-Based Health Alliance, and I'm joined today by Siobhan Simmons-Wright from Alliance for a Healthier Generation. We're also joined by Maddie Ha, who's managing the logistics and technology for this webinar, and by Andrea Shore. Andrea is the Vice President of Programs at the School-Based Health Alliance, and she was heavily involved in our Hallways to Health work. She will be here to respond to questions both in the chat and during the Q&A portion of our webinar. I'd like to begin by talking about our objectives today. By the end of this webinar, we hope that you'll be able to identify how the Hallways to Health Toolkit can support school-based health centers in creating cultures of wellness. We hope that you'll be able to identify the minimum requirements for local wellness policies, as well as some recommended language that can help strengthen policies at the local level. We hope that you'll be able to identify some best practices for engaging with district wellness councils and school wellness committees to support achieving shared goals. And we hope that you'll be able to articulate the role that a school-based health center might play in implementing a local wellness policy. I want to note that many schools and school-based health centers are operating differently, creatively, innovatively due to COVID. I know Siobhan will share a few ways COVID is impacting local wellness policies, and we at the Alliance are happy to answer additional questions about promoting school-wide wellness during COVID in the Q&A session, which will immediately follow our presentation. If you're curious about how SBHCs have adapted their services more broadly during this time, you may be interested in the recordings and reports from the Alliance's listening and learning sessions. In the spring of 2020, we invited school-based health center clinicians and administrators to come together and share questions, ideas, and strategies for adapting to best serve students in the time of COVID. Maddie will put a link to those sessions in the chat, and she'll also share a link to Healthier Generations COVID resources page. I imagine that many folks on the call are familiar with school-based health centers, but if they're new to you or if a refresher would be helpful, a school-based health center is a shared commitment between a school, a community, and a healthcare organization to support the health, well-being, and academic success of students. Local healthcare providers, often federally qualified health centers, hospitals, or health departments, bring expertise and link to an array of services, including primary care, nursing, behavioral health, oral health, and vision care on site to the school. And the school donates the facilities and utilities, as well as implementing building level policies that facilitate students' enrollment in and utilization of the school-based health center. The ultimate goal of the partnership is to create a culture of health within the school and among its community members. SBHCs can look a lot of different ways. Historically, we've seen that a majority of school-based health centers are at a fixed site on the school campus, but we know that there are also school-linked programs where healthcare organizations have a formal or informal relationship with the school to coordinate and promote healthcare for students on campus. We know that there are mobile programs, so programs that don't have a fixed site, but might serve multiple locations in a community through a mobile van or a bus. And we know that there are school-based health centers that are 100% telehealth. And as you can imagine, in the time of COVID, we have seen that many school-based health centers are adapting to provide some in-person care and some care via telehealth. Before Siobhan jumps in, I'd also like to share about our Hallways to Health Toolkit. Schools with SBHCs are in a particularly unique and strategic position to improve student and school employee health. Because SBHC staff see hundreds, if not thousands, of students each year, they have deep exposure that allows them to understand the landscape of student health needs and assets. For SBHCs to realize their full potential and impact, they must expand their role beyond the clinical setting and bring their knowledge and expertise into the wider school environment. In the Hallways to Health initiative, we tested the role SBHCs can play in school-wide wellness. The initiative was a learning collaborative as part of Kaiser Permanente's Thriving Schools initiative and community benefit program. 13 school-based health centers participated and were supported by the School-Based Health Alliance and their state School-Based Health Alliance to improve school-wide wellness. We provided training and technical assistance to the sites with the goal of creating space and time for building relationships to engage in rich learning and sharing across sites. The Hallways to Health Toolkit is a resource that includes learnings from the Hallways to Health initiative. The toolkit contains case examples and resources designed to support SBHCs in creating school-wide cultures of wellness. Many pieces of our toolkit complement the work Siobhan will share about today. So I'm going to kick it over to Siobhan to talk about local wellness policies, and I'll pop in here and there to talk about the overlap with our Hallways to Health toolkit.
Thank you, Emily. To create and sustain healthier school environments, it is important to think about coordinating policy, processes, and practices to support implementation and to measure progress and success. Wellness policies guide the process for creating healthier school environments. So what is a local school wellness policy? Just take a moment to think about that and also use the chat box to provide your answer. We'll give it just a few seconds. All right. A local school wellness policy is a written document that guides a local education agency, or LEA, or school district's efforts to establish a school environment that promotes students' health, well-being, and the ability to learn. Local school wellness policies support school districts' efforts to create supportive school nutrition and physical activity environments. This is important because each LEA participating in the federal child nutrition programs, including national school lunch programs and school breakfast programs, are required and responsible for developing, implementing, and monitoring and evaluating wellness policies. As we focus on creating healthier school environments, we must understand and know what policies have been developed and mandated to support our efforts. Healthier Generation has a model local school wellness policy that is a guide that includes policy language that aligns to the USDA Final Rule of 2016 language, which includes model policy language that meets the USDA minimum federal requirements and of the local school wellness policy implementation under the Healthy Hunger Free Kids Act of 2010. It includes the Alliance for Healthy Generations Healthy Schools Program framework criteria, which sets higher standards and schools and represents best practice in school nutrition, physical activity, health education, physical education that can be included in the local school wellness policy to establish stronger language. It also includes the whole school, whole community, whole child WSC model language. And this policy is also a great resource to support developing a robust local school wellness policy and can be used by district wellness councils to revise and or update local school wellness policies to meet or exceed federal regulations. Additional language that is included in this model local school wellness policy includes additional language for out of school time settings such as academic enrichment programs, summer day camps, specialty programs, etc., to support students' academics and its emotional development, as well as reinforcing healthy habits. It also includes policy language for all WSC model components and also the background information about the organizations that develop the WSC model framework. It also includes language to support district aligning their local school wellness policy to school improvement plans to support this close connection between health and chronic absenteeism. It includes recommended language to provide close communication between the district wellness council and leadership team to focus on health equity to ensure all students and staff have equitable access to health and wellness efforts, particularly low resource schools. And it also includes information about the WellSat 3.0, which is a quantitative assessment tool that can help districts assess and improve the strength and comprehensiveness of the local school wellness policies, and WellSat WSC assessment that has recently been developed to assist districts that wish to create a more comprehensive local school wellness policy that addresses a wide variety of mental and health areas. In addition, when we think about this model policy, it also provides support identifying and understanding how the information is referenced, such as the background and citations to support policy language to ensure compliance with the final rule, recommended policy language for each required section of the local school wellness policy that is shaded in gray. School districts can use this language to establish stronger policies as recommended by Healthier Generation. Recommended policy language for health and physical education, recommended policy language for the areas of the WSC model that are not required by final rule, callout boxes that elaborate on specific sections of the document that are highlighted in orange text, and then links to additional resources from Healthier Generation and partner organizations that provides a full list within Appendix A and glossary terms as well. So now that we have provided an overview of what's included in the model local school wellness policy, let's take some time to review the minimum requirements of the local school wellness policy based on the USDA Final Rule of 2016. So in order to be compliant with the USDA Final Rule of 2016, the local school wellness policy must at minimum include a school district's official to ensure compliance, public participation, standards for foods and beverages sold, standards for foods and beverages provided but not sold, specific goals for other school-based activities that promote student wellness, specific goals for nutrition education and promotion activities, and specific goals for activity opportunities. Note that I've only listed a few of the minimum final rule requirements. Take a moment to take a deep breath, do neck rolls right and left as you see fit, and think about the other items required, minimum federal items that I've left out. And we'll take just a few minutes to do that, or just a few seconds rather. As you're taking those deep breaths and the neck rolls, feel free to place your answer in the chat box. I know that's a lot to do it together, but again, as you're thinking and pulling the information in, what have I left out in order to be compliant? And we'll talk about those updates for 2020 in just a moment. Okay, so on the right side of the screen, I have listed the missing minimum requirements, such as food and beverage marketing, annual public updates, and triennial assessment. Based on my experience reviewing local school wellness policies from across the nation, these three components are frequently left out or vaguely mentioned in local school wellness policies. So when we think about the minimum requirements, the next two slides will provide a list of the USDA final rule minimum requirements. This slide focuses on nutrition education and promotion, physical activity, and food and beverage marketing standards, and which is listed on the in the model local school wellness policy on page 3. The next slide lists the 4 requirements that focus on public involvement, public updates, leadership, and evaluation plan, also listed on page 3 of that model local school wellness policy from Healthier Generation. Here are 2 resources, one from the USDA Final Rule Summary of 2016, and then Healthier Generation's Essential Components of the Local School Wellness Policy Checklist that will ensure that districts and anyone else, the people that are working on policies at the district level, will ensure that these minimum requirements are included. The Healthier Generations Model Local School Wellness Policy also includes a preamble statement to provide context and purpose for developing a wellness policy. All local school wellness policies should include a preamble statement that includes relevant state and local data supporting the needs for establishing and achieving goals in the policy. Even though it's not required, it is highly recommended to provide the purpose of the local school wellness policy and explain how the district will provide resources to support implementation and compliance. There are call-out boxes written in orange text throughout the model local school wellness policy. The call-out boxes are included to elaborate on specific information and which provides hyperlinks to resources. The call-out boxes on the slide provides examples of how the state and local data can be included in the preamble to outline the district's approach to ensure that the school's environment provides opportunities for all students to practice healthy eating and physical activity behaviors throughout the school day. The District Wellness Council. To comply with the USDA final rule, the District Wellness Council, sometimes referred to as School Health Advisory Councils or SHACs, the District Wellness Council convenes to establish goals and oversee the health and safety policies and programs, which includes development, implementation, periodic review, and updates of the local school wellness policy. The District Wellness Council section within the model wellness policy outlines the purpose of the council, public involvement and membership, council leadership role and responsibility, as well as recommended policy language from Healthier Generation. The model policy provides a list of recommended council members to meet the public involvement requirement of the USDA final rule. Council memberships should include representatives from the district level, school, community level that represents diversity of the local community. Even though there is not a set number of people that is required to be involved, it is important to include diverse representation that is reflective of the school community. Diverse representation can provide opportunities for various input, communication dissemination, engaging new partnerships, and health equity to support and sustain efforts, such as involving the school-based health center staff members. School-based health staff would fall under the community health professionals on this list. Now we will hear from Emily to learn more about the details of the school-based health staff's involvement.
Thanks, Siobhan. What I'd like to say about that is brief. I think certainly it makes sense in many cases for school-based health center staff to be involved in local wellness policy work, in district wellness council work, and I would encourage you to consider that broadly. So it certainly could be primary care providers. It might also be behavioral health clinicians from the school-based health center. It might also be the front desk person. So I don't think that it necessarily needs to be someone who is providing clinical care. I think often folks who welcome students to the school-based health center often have their ear to the ground around what students need, what students want. So my takeaway here is to consider that broadly. I'd also like to address the role of youth. You may find in your community that as you are developing or modifying your wellness council, you'd like to engage youth. We know that young people are the primary beneficiaries of a school-wide approach to wellness, and therefore they're critical partners. Ideally, their voices should be heard and active across design, implementation, delivery, and evaluation of school-wide wellness efforts. So I'm talking perhaps more broadly than just district wellness councils and policy work. In our Hallways to Health Toolkit, you can see some great examples from real school-based health centers about how SBHCs supported youth in leading wellness programming that was relevant and meaningful to them. I'd also like to share that the Alliance has a pretty detailed resource or toolkit on youth development and youth engagement. I'm going to ask Maddie to link that in the chat box. But as we talk today about both policy work and broader school-wide wellness, important to remember that young people are the primary beneficiaries and that we as adults have a critical responsibility to support their engagement in this work. Thanks, Siobhan.
Thank you, Emily. Okay, so now we'll talk just a little bit about the council leadership. Council leadership is usually the district superintendent or designated person appointed by the superintendent. Council leadership is required to be included in the local school wellness policy to be compliant with the USDA final rule of 2016. The leader is responsible for facilitating development of the local school wellness policy, updating the local school wellness policy, and ensuring each school's compliance with the policy via the school level wellness assessment and action plan goals achieved. The leader's name and contact information along with the district wellness council members are required to be available to the public via the public announcement, websites, handbooks, etc. to meet the USDA final rule. The recommended policy language from Healthier Generation states that districts should require that each school within the district establish an ongoing school wellness council or committee that supports local school wellness policy implementation as well as monitoring and reporting to the district. District and schools can refer to the School Wellness Committee Toolkit and the Hallways to Health Toolkit as a resource.
Thanks, Siobhan. In the Hallways to Health Toolkit, we have a section on building a wellness team. As Siobhan said, we know that changing school climate involves the participation of a diverse variety of stakeholders that will commit to and support both the work of school-based health centers and the work of the wellness team more broadly. We have some great examples of how folks recruited wellness team members, who they asked to be at the table, how they worked on developing a vision. So what are our shared goals for student success? I know that absenteeism is a big one, and some examples of how folks work together to define the roles and responsibilities of each member of the wellness team.
Okay, so now we'll talk about accountability and address a few of those questions that's in the chat box. The third section of the model policy is accountability, which is the USDA requirement to adhere to triennial assessment. This section includes the requirements of the triennial assessment, documentation, policy updates, and notification to the public. All of these key elements must be included in the local school wellness policy to comply to the USDA final rule. The triennial assessment requires districts to complete assessments of the local school wellness policy at least every 3 years to measure the extent to which the local school wellness policy meets the requirements of the final rule, schools are complying with the local school wellness policy, progress is made in obtaining goals of the local school wellness policy, and established school wellness committees can support district wellness councils in gathering data to measure school level compliance and progress. Healthier Generation policy language encourages schools to annually assess school wellness status and develop and update action plans to execute the local school wellness policy. Due to COVID-19, updates for the local school wellness policy and administrative reviews have been delayed until June 2021. So it was supposed to be updated this June of 2020, but have been delayed until 2021. These resources and materials can support districts updating the local school wellness policy by this time period of June 2021 next year. Next slide. Documentation. This policy outlines documentation that must include as records of the local school wellness policy and how the schools are compliant. This document will support the administrative review conducted by the state agencies. It is important for district wellness councils to collect this data for reporting purposes. Policy updates is required to be included in order to be compliant and to ensure key information that is listed there in the policy and on the screen is included. Notification to the public. All documents under the accountability section must be available to the public. Healthier Generation Model policy outlines specific information that should be included when notifying the public to ensure district meets the USDA final rule requirements. Notifying the public is another good strategy for building engagement and sustaining programs and practices to implement the local school wellness policy and health and wellness programs in schools. Developing a district wellness policy webpage to include all this information would be best practice strategy. It will also support centralizing all the necessary wellness policy information that should be included and publicly announced. Two resources that you see here on your screen, the USDA Local School Wellness Policy Outreach Toolkit and the Healthier Generation Public Update Guide are resources that will help to support notifying the public either via the website or other ways. Passing it on to Emily.
Thanks, Siobhan. If you are interested in sort of going above and beyond, if you feel like the work that your Wellness Council is doing is really wonderful and you'd like to share in a way that is beyond what is required of you by policy, you might want to consider some of the strategies that we have listed on our toolkit. So things like marketing strategically, using a variety of channels, engaging youth to share their voices, using storytelling, and as Siobhan has said, we know that effectively sharing the story of the work that we're doing can lead to additional financial or resource support. It can spur policy changes. It can build support for the work in the community. It can increase participation in our initiatives. It can model strategies that work so other school-based health centers can learn from us. A number of benefits beyond meeting the policy requirements to telling our stories.
Thanks, Emily. So here we have on the screen is two additional Healthier Generation resources. We have the School Wellness Committee Toolkit and an actual video wellness committee that works that can provide best practice strategies for developing and increasing district and school wellness engagement. Okay, so next slide. As I discussed, nutrition and healthy eating policy language, please stand with me if you can and perform 2 sets of tricep stretch on both arms, holding 30 seconds. Make the necessary adaptations as needed. Next slide. Nutrition services is the USDA requirement to meet the standards and nutrition guidelines for all foods and beverages sold to students on campus during the school day. Nutrition services should include school meals, which is one of the essential components that must be consistent with federal regulations. Child nutrition programs are focused on improving the health of students, help mitigate hunger and obesity, and models healthy eating by providing meals that are low in fat, sodium, abundant in fruit and vegetables, and whole grain. Next slide. As I present this slide, if you have some water, please model by drinking water right now. Access to safe, free drinking water will increase consumption and maintain hydration and is required to be included under the school meals to adhere to standards and nutrition guidelines for all foods and beverages. Competitive foods and beverages also known as smart snack items that are sold as a la carte in the cafeteria, vending machines, school stores, smart snack food carts, as well as food-based fundraisers during the school day must meet smart snack guidelines in order to be compliant with the USDA final rule. In some cases, states have passed nutrition standards for competitive foods and beverages that are more stringent than the smart snack standards. In these states, districts and schools must comply with both federal and state standards, and both standards must be listed in the local school wellness policy. On this next slide, you'll see two resources, one from CDC, the Water in School Toolkit, which is a great resource that can be used to increase access to drinking water, and is highlighted within the actual model policy. And then Healthier Generation Smart Snack Calculator, which is a free interactive tool that allows users to enter information from the nutrition facts panel to determine if the food or beverage is compliant to smart snack standards. Standards for all foods and beverages provided but not sold, provided but not sold. So we have to make sure we pay attention to that, to students during the school day include celebrations, classroom snacks, and rewards offered during the school day. To comply with the USDA final rule, the district will ensure that celebrations, classroom snacks, and rewards are consistent with standard nutrition policies. Each district is required to set their own standards as it relates to food and beverages provided and offered to students. Using food as a reward and withholding food as punishment undermines healthy eating habits and interferes with the student's ability to self-regulate their eating. Policy language that states food and beverages will not be withheld as punishment for any reasons must be included in the local school wellness policy. Also, districts should use rewards that promote physical activity and promote educational messages instead of foods and beverages. Healthier Generation recommends that all foods and beverages provided to students meet smart snack standards to ensure consistency between foods offered and foods sold on school campus. Here are 3 best practice resources linked in the policy that can support schools meeting this goal. The next resource you see here is from my hometown here in Wake County, North Carolina, Wake County Public Schools, and they have the Child Nutrition Program created a Smart Snacks brochure that includes food and beverage items that can be ordered through the program for celebrations, classroom snacks, and rewards. This best practice resource and strategy helped the district adhere to smart snack options provided to students. Okay, so again, now that we're moving on, as I go through the food and beverage marketing, take a moment to perform 30 reps of standing bicep curls as I continue to discuss food and beverage marketing. Again, make the necessary adaptations. Food and beverage marketing that promotes unhealthy foods and beverages can weaken health and wellness efforts at school. Only foods and beverages that meet or exceed smart snack and school standards can be marketed or advertised on school campus. These items and products consist of interior of vending machines, posters, flyers, menu boards, coolers, trash cans, and other food service equipment, cups used for dispensing. Please note that athletic school boards are grandfathered in, but must be changed to meet the policy when new renovations occur. Fundraising. Fundraising efforts provide opportunities for schools to increase additional revenue for educational resources. The model policy outlines language to support compliance of the USDA final rule and recommended language that all fundraisers throughout the school year sell only non-food items or food and beverage items that meet smart snack standards. The call-out box on this page in the policy, model policy, highlights states allowed to set the number of fundraisers each year that are exempt from the requirements. Districts may follow fundraising exemptions and guidelines set by their state education agencies or may set more vigorous fundraising standards throughout their local school wellness policy. Districts should ensure that fundraising policies are clearly communicated to schools. The next slide indicates or has 2 resources, again from CDC, and it's focused on healthy fundraising, not only for just the school, but also ideas for parents. Both nutrition education and promotion is required to be included in the local school wellness policy in order to be compliant. The model policy outlines both nutrition education and nutrition promotion separately to ensure key requirements is included in the language. So as I go through physical activity, feel free to stand and march with me or make the necessary adaptations. Active living research shows that infographics, which features evidence on how physical activity and fitness may help school-age children maximize their academic performance, and provides an overview of effects of physical activity on the developing brain. Policies that support daily physical education and regular activity breaks during the school day can help increase physical activity, improve academic performance, and improve classroom behavior among students. To ensure optimum health, all children and adolescents should receive 60 minutes of physical activity daily. The USDA final rule requires local school wellness policies to include specific goals for physical activity that can be in the form of physical education, classroom physical activity, active academics, daily recess, before and after school activities, sports, active transportation, which is outlined in this document. As we continue to march together, as you see fit, Healthier Generation provides policy language for physical activity, which also includes the language that prohibits the use of withholding physical activity as punishment. The recommended policy language also states physical activity opportunities must be adapted for accessibility for students with disabilities. Classroom physical activity and daily recess opportunities can support students achieving 60 minutes of physical activity daily. The policy also includes several resources to support physical activity opportunities during and after the school day, such as the strategies for recess in school. Other activities that promote student wellness is a requirement of the USDA final rule. Integrating wellness activities across the entire school setting can be offered through multiple strategies. The recommended policy language includes various strategies along with hyperlinks to best practice resources that can provide guidance, including this component in the local school wellness policy. Take a moment to rest if you haven't already done so. Even though USDA final rule does not specifically require health and physical education to be included in the local school wellness policy, in order to be compliant, and there is no federal mandate of health education and physical education to be taught, districts across the country have enacted policies requiring health and physical education to be taught in grades K through 12 to support meeting the needs of all students and to support the development of lifelong healthy habits. Health and physical education can be included in the local, or should be included in the local school wellness policy through nutrition education and physical activity opportunities. Including health and PE, policy language provides a clear message to the schools and stakeholders of the policy that are in place to support students' health. It is also crucial to ensure adequate resources are allotted by the state and district level for high quality programs to support implementation. So while I discuss health education, which is short, please perform 2 sets of 10 or 20 squats, and again, make the necessary adaptations. Health education emphasizes the teaching of essential healthy topics and skills necessary to adopt, practice, and maintain healthy behaviors, such as choosing nutritious food and engaging in regular physical activity. Nutrition education is a critical component of the health education curriculum. Healthy eating and physical activity topics should be included in health education curriculum. There are national health education standards that promote and support healthy eating and enhancing behaviors for students in all grade levels and should be taught by a qualified, trained professional. And if you feel, continue to move forward the squats. If not, just rest. Physical education is an academic subject and serves as a foundation of coordinating school health and physical activity program, CSPAP. Physical education provides students with a planned, sequential K through 12 standards-based program, curriculum, and instruction design with the opportunity to develop motor skills, knowledge, and behaviors for physical activity. Physical education should be included in the local school wellness policy as a best practice strategy for increasing physical activity for students to meet the recommended daily physical activity minutes, 60 minutes. Other physical activity experiences such as recess, Intramural sports and recreational endeavors should not be used as a replacement for physical education. This policy provides specific goals for elementary and secondary physical education that should be outlined within the actual policy. Another resource, great resource, is the CDC Virtual Healthy Schools, which can provide great examples of how nutrition and physical activity can be integrated throughout the entire school settings. It's an interactive tool as well. The WSC model. How many of you all are familiar with the WSC model? Whole school, whole community, whole child model. Please just take a moment to give me thumbs up or yes or no in the chat box. The WSC model is centered on the school while connecting to families and the community to address the needs of the whole child. Districts should use the WSC model to provide greater alignment, integration, and collaboration between health and education. The Model Local School Wellness Policy has addressed 3 components of the WSC model: nutrition, environment, and services, health education, and physical activity. Physical and mental health policies and programs should be included in the local school wellness policy to focus on all aspects of the student's health. When incorporating these additional WSC areas into the local school wellness policy, be sure to address any state or district regulations related to the areas and include those responsibilities for implementation on the District Wellness Council. All right, so we do have quite a few people here that are familiar. Good. Healthier Generation, together with Kaiser Permanente, launched the Resilience in School Environments, RISE, as we call it, the RISE initiative, to support teachers and students with tools and resources to better manage emotions, recognizing strengths and weaknesses, and rise above adversity. As a result of COVID-19 pandemic, schools and districts are navigating unprecedented times of shift in their learning environments. And with this, it creates a even greater resource or needs for resources to support the well-being and resilience of students and educators. By design, Healthier Generations RISE initiative is well equipped to immediately meet the needs of students and staff. I'll encourage you all to take a moment to click on the RISE initiative hyperlink on the page within the document and learn more about how to use this within your districts and schools. Social and emotional climate can impact students' engagement in school activities, relationships and other students, staff and family and community, as well as academic performance. It is also conducive to effective teaching and learning. Districts can commit to creative, positive social emotional climates across the entire school campus. Counseling and psychological services to meet the needs of the whole child should be involved or included in the local school wellness policy, and those representatives should also serve on the District Wellness Council. This will ensure representation and inclusion of necessary support services to promote successful student learning process. Health services, and again, feel free to join me in the quad stretch. Make sure that you're making the necessary adaptations. Health services is also another important service to offer at schools to ensure the optimum health of students. School-based health centers services fall under the health service section. Some districts will have separate policies that address health services. However, it is important to include a link that is within the Model Local School Wellness Policy or within the district wellness policies to display how it relates to the whole child model. Emily will provide us additional information about the school-based health center involvement.
Thanks, Siobhan. I think that I got a little too excited earlier and said my piece about thinking broadly about which staff from the SBHC should be involved. But in a moment, I'll talk a little bit more about how SBHC staff can work with school partners, parents, and caregivers. But for now, I'm going to turn it back over to you, Siobhan.
Okay, and continue with those quad stretches on the other leg if you can. The physical activity environment also plays an important role in student health. Physical conditions inside and outside of the school facility must be safe from physical danger. The physical environment should be safe for use for students, staff, and community members. A facilities manager or director should serve on the District Wellness Council to ensure physical environment is discussed and proper protocol is presented to ensure the health of students in all schools. School nurses treat asthmatic students on a regular basis and have worked with facility managers to ensure the physical environment is safe and conducive for students to work, learn, and play. Please share in the chat box how you have worked with, or if you have worked with, facility managers in the past to support creating safe, ventilated environments for students. The chat box, the call-out box on this page highlights asthma as one of the most common chronic health conditions among students. It also hyperlinks to the policy language that protects students' lung health from the American Lung Association. Okay. Employee wellness. School employees' physical, social, emotional, and mental health needs are pivotal to their well-being and students' academic success. Employee wellness programs and healthy work environments can decrease employee health insurance premiums and reduce the employee absenteeism and turnover, which is very important. Schools should create environments that support healthy eating and physical activity, healthy behaviors, and address social and emotional health of staff through explicit focus on staff management, maintaining positive relationships, teacher self-efficacy, and support purpose of driving the work. And I'll turn it over to Emily.
Thanks, Siobhan. I was really struck just now when Siobhan said that a benefit of focusing on employee wellness is that it can reduce absenteeism. And in preparing for our talk today, I was going back through some of the Hallways to Health resources, and there's a great example, and I don't remember where the school district was, but teacher turnover was a really big issue there. And so as they were doing, again, this school-wide wellness work, they talked with teachers who said, we want to promote wellness for students, but we need support as well, which I think is exactly what Siobhan is saying. So there are some great examples, again, of how schools supported staff by offering wellness programming. There was one school that was able to offer Fitbits. They had a walking competition. There's also, I'll talk in a moment about engaging other partners. If we're going to do staff wellness that involves giving everyone a Fitbit, we need to find a way to pay for that or for someone to donate it. So I encourage you to think of these pieces of the Hallways Toolkit as sort of interconnected. So when we engage school partners, we might be better able to engage parents, and when we engage the community, that might undergird our work in supporting school staff wellness.
Thank you, Emily. So as we know, parents, families, caregivers play an important role in shaping opportunities and outcomes for students, and because of their powerful influences, families can be catalysts towards school-wide wellness. Therefore, it is important to ensure the district and schools engage them in meaningful ways and make efforts to sustain their engagement. Community organizations also play a major role in supporting district and school-wide efforts. Community organizations such as cultural, civic organizations, social service agencies, faith organizations, health clinics, college universities, local businesses can create partnerships to offer resources, services, and support to students' learning and development, as well as the physical and mental health of students and staff. There are two groups to encourage to serve on, that should be encouraged to serve on the District Wellness Council and School Wellness Committee to meet the public involvement requirement of the final rule. Next slide. All right. So here's a question for you all. If you can, in the chat box, share strategies for engaging families and community members in school-wide wellness and policies and programs. How have you done that? And we can move on to, as you all are typing that in the chat box, we can go ahead and move on, Emily, to the next slide so that you can talk about those ways as people are brainstorming there.
Thanks, Siobhan. My guess is that there is going to be some overlap between what we will share and what you all might share in the chat box, but we know that often school-based health center providers and other staff have strong relationships with families, and we encourage you to consider how you can leverage those relationships to improve the wellness of those families. We would suggest offering a variety of ways for parents and caregivers to be involved. There are some great examples detailed in the Hallways to Health Toolkit of how SBHCs hired parents to be health educators, and sort of on the other end of the spectrum, how school-based health centers work to connect parents and caregivers to social services. So I'm sure that many of you are already doing this, but if you're looking to invigorate or reimagine that work, the toolkit might be useful for you. I mentioned earlier that it's also important to think about how we engage community-based organizations and businesses. I know Siobhan talked about this as well. Identify shared priorities, assess when a formal partnership might be useful, and think about what it could look like for these folks to be represented on your wellness committee. There are some great examples that we've seen around how local food banks, hospitals, gyms, YMCAs, nonprofits, universities, businesses have donated goods or services or provided grant funding to support school-wide wellness efforts. And it's important to think of these relationships as bidirectional. So it certainly can benefit the SBHC and the school community, but it might also benefit a local business because it gives them exposure. So finding ways to really work towards win-win partnerships in this case, I think, can be beneficial.
Okay, so hopefully you had a chance to get your physical activity in while we've gone through this webinar. What I would like to hear from you all, and thank you for the examples that you provided in the chat box so far about how you engage families and as well as community members. But I would like to also know, based on the information you received today, what will be your next steps? What would you do with this information? And again, as you're thinking through that, if you like to join me in marching and standing up one last time, feel free to do so. But if not, just go ahead and start typing that in. And we'll give you a few seconds before we go on to the next slide and give you our input or suggestions on what next steps could be. Okay, so next steps, review and share Hallways to Health Toolkit and Healthier Generations Model Local School Wellness Policy. Share it with people that you work with those committees. If you're not on an actual committee at the district level, inquire about it. Same thing at the school level. We all know that there is a requirement to have a council or district wellness council or committee at the district level, but also if there isn't one at the school level, maybe think about jumpstarting that. Review your district and school wellness policy to ensure minimum requirements of the USDA final rule components are included. And also think about how it can be revised for this upcoming school year and reflect all of those minimum requirements as well as maybe some of the WISC models by June 2021. Identify how to become more involved with the District Wellness Council and support school level implementation and progress, and use resources and strategies to create healthier hallways and school environments. And thank you for joining us today. And my information is there. So if you ever have a need to contact me, I do review policies and provide feedback. And I also provide that technical assistance as well as connect you to other resources that may be helpful. And Emily, I'll pass it on to you.
Thanks, Siobhan. We're going to talk through questions in a moment, but Maddie, I am seeing a lot of really incredible examples in the chat. Someone did think takes, someone hosted water aerobics. I wonder if you and I, after this webinar, can put these ideas that folks shared on the slides so that if someone wanted to look back, they could see what other people are doing. I'm excited about these. I saw that Johnny said that they always offer food. I love that. I really want to be able to capture these. Is that feasible for us, Maddie, to save the chat?
We can definitely do that.
Awesome. Okay, so I'm going to stop screen sharing and we can talk through questions if you have them. Maddie will show on the screen how you can enter them if you have already.
Okay, this is Andrea. I'm going to let you all know some of the questions that came in, and I'm so excited to see several people even putting in the chat box that they're currently or their team members are sitting on school district wellness committees. Very exciting. So I think this first question, Siobhan, I believe is for you. We have a question saying that you mentioned administering assessments of children to address some of the issues mentioned in the presentation. What are the assessments that are used and how are they administered?
Yes. So when we think about a school wellness assessment, school level wellness assessment, you have a multiple school wellness assessments. The one that I'll refer to first comes from Healthier Generation, and it's called the Healthier Generation Healthy Schools Program Framework. It is our framework, but it's also an assessment, online assessment, and that is free to use, and it is aligned but a very condensed version of the School Health Index from CDC. So if you've ever heard of the CDC School Health Index, you will see that the questions are very, they're the same, if not similar in the way they're written, and it might not be the entire School Health Index, but it is condensed. We have about 50 some odd questions, I'll say 53 to be exact, for the Healthy Schools Program Framework assessment that schools will use. And like I said, they're able to go in. We have a 6-step process. They can complete the assessment, then create an action plan, connect directly to resources, and then from there implement, share success, and then that whole process starts over. We also have an award program that is aligned to that framework. So as schools are implementing best practice strategies and programs within their schools, they could actually be recognized at the national level. So the two that I will refer to is Healthy Schools Program Framework, and then also the CDC School Health Index. But there are a few others depending on where you are across the country.
Great, thanks, Siobhan. You answered one of the other questions that came in about the School Health Index. So thanks, that was 2 in 1. So one other question that came through, I believe, is probably to us, Emily. It was asking about, and I see Marie mentioned starting a conflict resolution program, which sounds really exciting. And how can I use the toolkit to assist me in the development of a conflict resolution program for elementary and middle school students as an after-school program? And I do believe strongly that the Hallways to Health Toolkit can help you with that. And hopefully the parts that Emily has highlighted throughout the presentation give you a sense of what's in there. But it really can help you in soup to nuts to develop a school-wide program. In each of the sections that you saw her pull up on the slides, you'll see tips on best practices from what Hallways to Health sites did within their programming's stories from the field. So there might be some that you want to borrow. And there's also resources and tools that we link you to throughout. So it really will help you figure out the partners in developing this program, any additional data you might want to collect in your needs assessment stages, developing the action plan, and really getting that buy-in from partner and support groups, as well as how you might want to sustain the program. So it really is a comprehensive look at how to think about partnering with school staff in implementing a school-wide program. And if you do have detailed questions as you dive into the toolkit, feel free to reach out to us at the School-Based Health Alliance. Anything else you'd add there, Emily?
I don't think so. I was just trying to think. So I think what Andrea has shared is really about the process. I'm thinking about whether there are other resources on my radar related to the content around conflict resolution, but I think that the toolkit is a great place to start in terms of developing a framework. And I would say that if there's a program you see that seems to be really kind of up your alley, let us know, and we'll see if there's any additional resources that we have internally from when the work was taking place that we're able to get permission to share with you.
And if I may add, also, when you look at the Model Local School Wellness Policy, you'll see under the social and emotional climate section within the policy that there is a policy language that talks about conflict resolution. So I definitely look at that, because we know that as we're creating programs and processes in this actual school, is to sustain policy helps with that sustainable process.
Oh, that's great. Thanks, Siobhan.
Yeah.
And Siobhan, another question for you that came in is, can you restate exactly what will be required for districts by June 2021? And are there tools to support creating the triennial assessments available?
Yes, so Healthier Generation has those tools, and what is actually required is when we think about the USDA Final Rule of 2016, the implementation of the USDA Final Rule, it started in June of 2017. So with that being stated, when we think about the 3 years later, it brings us to June 2020. So that means all districts are required to update their policies based on the assessments that schools have completed and the data that they receive from those assessments. So districts' wellness councils are required to go in, look at that data, look at their policy, compare it. So when we look at all those 3 key steps in the triennial assessment, that's what we need to focus on. That's what districts need to focus on when they're updating their policy, comparing it to a model policy, and then also looking at obtaining those goals. So that is now pushed back to June of 2021, and all of that information can be found on our website. Or you can, contact me and I can send you direct links. So absolutely, when we think about that triennial assessment and those updates for the policy is required by June 2021 due to COVID.
Thank you so much, Siobhan. Unfortunately, that's all the time we have. Thank you so much, Siobhan, Emily, and Andrea, and everyone for joining us today. I just launched our evaluation poll questions, so if you could take a moment to answer those, we would greatly appreciate it. And thanks again, and we hope you have a great rest of your day.
Thank you.
Bye, everyone. Thank you.